This is the IM sub-Q lab.
Okay, so I'm going to pretend I was assigned IM injection, and after I do that, I'll do the sub-Q injection. Okay, so as always, I look at my time, I write it on my paper to make sure I don't go over, and I start writing my mnemonic. Some really rich cat imagine goes past. This mnemonic goes for both IM and sub-Q, so whatever I'm not going to need, I'm going to cross it over. So select med, record, rule, and pH. So I'm not going to need this one, so I'll cross it. Clean my vials, ID patient, blood up, pinch or tense. So since it's IM, I'm going to cross the pinch, aspirate, and sign MAR. Okay, so first thing first, select my medication. So I'm going to have about 4 or 5 vials here, and I need to inject medication A, 1 milliliter, and medication B, 1 milliliter. So I'm going to look for A and B. Let's say this is A and this is B. Okay, and once I select my medications, I need to record. So I'm going to come to this form here, and where it says drug, I'm going to put med A. I need to give 1 milliliter, and med B 1 milliliter for correct total dose of 2 milliliters. Okay, so these I'm going to give ventrogluteal injection, so I need a needle that's 1.5 inches long. So among all the needles, I'll select that one. Let's say it's this one. So open it, and then make sure to clean your vials. I use 1 cotton for each vial. Okay, and first thing, to put 2 milliliters of air into my syringe, then infuse it into the first vial, all the way to 1. Okay, and then go to your second vial, infuse the rest, and now we're gonna draw the medication. I can see some big bubbles here, but what I'm gonna do is draw a little extra so I can expel the bubbles. That we won't be able to do with the second medication, so it needs to be really exact. Okay, here we go. Show the C that you have to verify that you have the right amount. And now we're going to go into the second vial. I like to clean it again. And then in and up, just very slowly. If you go really slowly, there's less chance that bubbles are going to build up. That was what I found out. If you go fast, there's more chances of bubbles. So you see, go very slowly, there's no bubbles, and make sure you stop at the 2 millimeters. There we go. Okay, that's done. I'm going to recap my needle because I need to still give the medication to the patient, and I like to put it back into the pouch for sterile purposes. Put it here. My next thing will be to ID my patient. So I can grab my gloves just to have them in my hand. Grab my MAR. Go. So we have Teddy Brown, 91472, 91472. Very good, I have the right patient. So I'm going to put my gloves on. Now remember, I don't have a model, so I'm going to use my hand and I give a deep IM injection to a hand. we're gonna clean the sides. So always from the middle, circular towards the outside. Okay. Grab my needle. This I'm gonna tense, 90 degrees, go in, make sure you aspirate, and then go in slowly but surely with the medication. Okay, that's it for that. The needle straight in the sharps containers. Remove your gloves. You'll wash your hands. And then the final thing is to just sign the mark. Make sure you put your Excelsior College student nurse, your initials, and then the initials up here. And this is it for the IM injection.